So this is the specimen of spleen, which is the largest lymphoid organ in the human body, and it is situated in the left hypochondriac region behind the mid-axillary line between the stomach and the diaphragm and 9th, 10th and 11th rib. So spleen has one apex and one base. So this is the apex and this one is the base. It has visceral surface and the diaphragmatic surface. So there are two surfaces, visceral surface and the diaphragmatic surface. It has three borders. This is the superior border, this is the intermediate, and this one is the inferior border. How you are going to identify superior border? Superior border is having this concavity. So hold it in such a way that the concavity should be upward. So this is the superior border. Also superior border is lobulated, right? So you can see the lobulation. So this is the superior border, this is the intermediate border, and this is the inferior border. This is the apex and this one is the base. Now how you are going to hold the spleen? You have to hold it with the left hand because it is lying in the left hypochondriac region. The apex should be anteromedially, the superior border should be superior, and the intermediate border should be facing medially. So this is the anatomical position of holding the spleen, right? Now this is the impression for stomach, and now at the inferior border you are going to see the impression. This is the impression for your anterior surface of kidney. This is the impression for left colic flexure, right? And here there is the impression for tail of the pancreas. These are ligaments, right, which is lying at the hilum of spleen. There are two ligaments, one which is going towards the kidney. This is leno-renal ligament, right? So this is the leno-renal ligament which is having splenic vessels, and there is another ligament which is going towards the stomach, that is gastrosplenic ligament. There is another ligament which is lying near the colic flexure impression and to the diaphragm, that is phrenico-colic ligament. Now talking about the diaphragmatic surface is related to 9th, 10th and 11th rib. My fingers are showing 9th, 10th and 11th rib. So this is how you are going to hold it. Now talking about the basal angle. In spleen there are two basal angle, anterior basal angle and the posterior basal angle, as you can see in the image. Anterior basal angle is formed by the meeting of superior border with the lateralmost part of the spleen, and the posterior basal angle is formed by the inferior border and the lateralmost end of the spleen. So as you can see in the figure, these are the anterior basal angle and the posterior basal angle. Anterior basal angle is also known as clinical angle because this is the most prominent palpable part which could be felt during spleen enlargement in the left costal margins. Thank you.